If it seems like everyone and their kid is sick, well, you're not alone. Flu season is at its peak, and Quebec authorities project this may be the worst season it's been in nearly a decade. If we look at the situation in early February, no year in the past 10 has come close to how bad it's been for influenza A. Testing all but nearly stopped during the pandemic. Over 4,600 cases were reported in the last week alone. That's almost double what we usually see in the worst weeks of the season.
We can really tell that we are in the middle of an intense influenza A season right now.
Usually, flu cases taper off midwinter, but since December 2024 to this February, influenza A and B cases have been rising nearly 30%, and they keep going up.
By February, the number of cases will go down, and usually we start having a bit of a rest in the emergency room, which is not what we've been seeing this year. As the peak is a bit later this year, we're actually seeing record number of people coming into ERs in the last few days.
But authorities are holding off before raising alarms. Quebec's Institute of Public Health says it will be able to make a better assessment in the coming weeks.
There have been some very severe cases so far this year, but overall it's hard to say whether this season is out of keeping with what one could expect from influenza.
But why are cases up? Experts say we don't really have a concrete answer. But if you're worried that we might be dealing with something new here, authorities say we're not.
The strain that is circulating right now, we don't have any signal that it is a special strain, something that is more transmissible.
If you're feeling ill, flu symptoms are muscular aches and pains, fever, cough, headaches, and doctors say it shouldn't last more than a week. Most cases, all you can do is wait it out.